Don't tell me kids are not affected by COVID-19. In a recent study pre-published in Pediatrics, over 140,000 children from April 1st, 2020 to June 30th, 2021 experienced the death of a parent or a grandparent caregiver from COVID-19. Not surprisingly, the authors estimate that racial and ethnic minorities made up about 65% of these children in the U.S. The highest burden of COVID-19 associated deaths of parents and caregivers occurred in the southern border states amongst Hispanic children, southeastern states for Black children, and in states with tribal areas for American Indian or Alaskan Native Americans. Primary caregivers could be parents or grandparents in charge of most basic needs and care. Secondary caregivers are those who take care of some of the basic needs, but not all. The article goes on to say that in the 15 months of the pandemic, over 120,000 kids have experienced the death of a parent or a primary caregiver. Over 22,000 have experienced the death of a secondary caregiver, with the grand total of over 142,000 kids in the U.S. who have experienced loss of a primary or secondary caregiver. Do not say that COVID-19 does not affect children's lives. This is not the flu. Vaccination is our way out of this pandemic. Today, Pfizer submitted data to the FDA for emergency use authorization for children 5 to 11 years of age. So we are making some headway, but this study is incredibly eye-opening. Watch for part 2 on limitations of this study. Remember this study in Pediatrics that stated over 140,000 children have had the death of either a primary caregiver or a secondary caregiver from a COVID-19 associated death? Just like with any study, there are limitations and the paper does disclose these. Firstly, this could be a gross underestimation because there could be a delay or complete underreporting of deaths. Secondly, there can definitely be underreporting by the prevalence of co-residing grandparents, who we as know from the first video could specify as either a primary or secondary caregiver in the household. One of the other limitations, which you all know from my first video, is that we talk about how the deaths do adversely impact racial and ethnic minorities, is the fact that perhaps the children who were bereft don't have the same race or ethnicity as their parent. These limitations are important when you're looking at data, but we also have to look at the long-term impact of what this study is talking about. Orphanhood and caregiver loss qualifies as an adverse childhood experience, or an ACE. ACEs can have profound impacts on the long-term health and well-being of a child. Loss of a parent is associated with mental health problems, shorter schooling, lower self-esteem, sexual risk behavior, risks of suicide, violence, sexual abuse, and exploitation. After a caregiver's death, it's not only the grieving process, but the fact that a child's entire family and life circumstances can change. Housing separations, instability in relationships, and lack of a safe, secure, nurturing relationship can set up ACEs to potentially worsen the impact later in life. So let's stop this terrible domino effect of the pandemic. Get out there, get vaccinated, and hopefully we can get our children vaccinated soon as well.